Hello, good evening. Thank you for the introduction and for the opportunity. I think I speak for both Kim and myself, the opportunity to present tonight. Can you hear me okay? Okay, somebody please, okay, louder? Okay, I'll do my best. Please wave if I get too quiet. Just as a little bit of an outline, we're going to talk very briefly today about communication and how communication might be affected in people with dementia. And then we're also going to talk about ways that caregivers might use different strategies to make communication more effective, more efficient, and perhaps more importantly, more enjoyable and more meaningful. And also I want to just make a claim because we are in the setting that we're in. It says dementia, but we're really going to be focusing on communication of people with Alzheimer's disease. And while many of the strategies that we're going to talk about I think are really probably useful across different types of dementia, or probably all of us in our daily lives, we're going to talk about communication effects of Alzheimer's disease, and we might expect some differences in communication profiles in some of the different diagnoses. Okay, I am a women's health fellow at the VA, and as a disclaimer, everything in this presentation is my own and Kim's responsibility. Okay. I want to start today by issuing a bit of a task for everybody over the next day or so. I want you to think about all the different ways that you communicate, or all the different reasons that you communicate throughout your day. We communicate in almost every aspect of our lives, and so it really becomes second nature, or something that we often take for granted until something goes wrong or until we're having problems. And so to get you started, I have a list here of different reasons we communicate, or different communication acts. How many of you today asked a question, whether it was just to actually get information or just to strike up a conversation? Yeah, most of us. We probably shared some sort of idea that we had, or some feeling that we had. We often use communication to give information, to teach, to learn, to persuade. So last night, I gave the hint to my husband, I don't really feel like cooking tonight, in an attempt to persuade him to bring dinner home. We also use communication to share our needs, and it might be something like, I'm cold, I don't feel well, I'm in pain, I need a doctor, or something as simple as, I could use you to sit by me for a while. One thing at the VA, in the memory clinic, something that's really had an impact on me is how much we use communication to entertain. And so I don't know how many veterans I've seen where they love to tell jokes, they tell stories, they tease the nurses, and this is really a part of their identity. And so when that gets more difficult or harder to do, it can be really devastating. Maybe just as much so as being able to ask for what you need. And then also, I think that often we communicate just to connect. I know we're very busy, but I think there's something to just talking. If we talk to a friend and we can't really remember what we talked about, but we had a good time, we enjoyed it. And so I think this is just a list, and so I'll ask you to just be mindful over the next day for all of the different ways that you communicated. Okay. We are going to spend a bit of time. Kim is going to go over the ways that communication can be affected by Alzheimer's disease at different stages. And we're going to try to organize this information according to the graphic that you'll see here. We've kind of broken communication and language specifically into 3 different components. And so you can see in this kind of blue-purple circle the aspect of language that's content. We think about this as being able to map our ideas about words, our concepts about people, into the words that we use to describe them. We also use language form, which we might call grammar or syntax. And this is often preserved until the later stages of dementia, but this is our ability to put these words together to convey what we mean. And then finally, language use, or pragmatics. And this is our ability to use all the different skills that we have, language and non-linguistic functions, to communicate effectively across different contexts. So to do all those different things that we talked about. And I also want to start by just kind of characterizing the early communication changes that we might see in somebody with Alzheimer's disease, perhaps as a cognitive communication problem. And I call it that because often the communication signs that we see are really probably the effects of early cognitive changes rather than a language problem per se that we might see in somebody who's had a stroke. Okay, I'm going to turn it over to Kim for a few minutes.
Thank you. So I am going to talk about the changes that we see in language in Alzheimer's disease, so not the primary progressive aphasias or the atypical presentations of Alzheimer's disease. But I did want to just call your attention to the fact that some retrospective studies have been done with some very well-known people. And there are subtle changes in language that can be seen well in advance of clinical symptoms. And so that begs the question as to whether or not speech and language can be a marker for early change. And also, it will help us get more insight as to what our intervention targets can be and how early we can start to intervene. This is some of the work that I'm doing with the Wisconsin Registry for Alzheimer's Prevention. So I'm looking at very, very early, subtle changes to speech. So this graphic will give you an idea of what we're seeing. In pre-MCI, there's not a lot known because there's not a lot of research in that population. But we have in our Wisconsin Registry started to see some very early changes before clinical mild cognitive impairment, but at the stage where a person's memory is clearly declining. But the thing I really want to call your attention to is the syntax line, which is that form from Lindsey's graphic. And it doesn't get impaired until later on in the disease. And we think that the rules of grammar are actually part of the procedural memory and are stored in a place that is preserved for a very long time. And so that's very interesting and something that as speech pathologists we want to capitalize on. So going back to that graphic in those three areas, in mild Alzheimer's disease, the prominent symptom in language is going to be word retrieval problems. And these are not the typical age-related word retrieval problems. These are much more invasive. And what happens there is that because of the word retrieval problems, we will see difficulties in social language use. So if someone's having trouble retrieving a word, they might shift the topic all of a sudden because they're feeling uncomfortable that they can't find that word. Or they might start talking around and around something, or use a lot of pronouns or non-specific language. And so it can be very difficult to decipher what a person is saying when they're having word retrieval problems. But again, grammar and sentence structure sounds perfectly normal, and a lot of social skills are still preserved in mild Alzheimer's disease. So when we get to the moderate stages, this is where comprehension really starts to break down. And while syntax and grammar is preserved in expressive speech, it starts to be degraded in comprehension. So it's harder for the person to understand complex sentences. And that's one of the main problems in moderate Alzheimer's disease with language. The word finding becomes increasingly difficult, and their language becomes increasingly nonspecific. Finally, in severe Alzheimer's disease is when we start to see changes in not only production of words, but in articulation. You might start to hear more jargon. Words don't sound like they used to. I have down there in the use portion that there's intact prosody, so the jargon may sound like the normal contours of speech, the melodic line, but there's a lot more jargon there. So you would expect, and we've talked about in various contexts, that if someone's having difficulty communicating, this results in some of the problem behaviors that you might see, and some of the aggression and some of the difficulties that we see in Alzheimer's disease. And we think that, but somebody has actually studied this, which shows here, this graphic shows that while a patient's status directly influences the burden felt by the caregiver, it's communication problems that are actually the mediating factor. So if communication is more impaired, you'll see more problem burdens and therefore more problem behaviors and therefore increased burden on the caregiver. And so this graphic is extremely important to what we are trying to accomplish as speech pathologists. And we've studied this, speech pathologists have looked at this and other researchers and have found that caregivers of people with AD report that their problems contribute to their stress and their burden. And we've seen that by educating the caregiver on the problems faced in language and Alzheimer's disease, it may improve coping and satisfaction in caregivers, and the use of communication strategies may actually improve the function of individuals with Alzheimer's disease. So I'm going to show you one beautiful study that was done where there were two outcomes. One was the person with Alzheimer's disease completion of an activity, a very basic daily living activity, toothbrushing. And so the outcome was how many steps of this toothbrushing were they able to successfully complete. And these are people with moderate to severe Alzheimer's disease. The other outcome was what were the communication behaviors that the caregiver provided during that activity. So they were videotaped, and everything that the caregiver said to the participant was documented and coded. And what they found was that these are the strategies that caregivers naturally used that were associated with successful completion of toothbrushing. And so some of the ones that were most associated with success are using one proposition at a time. So really not combining two-step directions, just one-step directions at a time. Using closed-ended questions, so yes or no questions, not requiring a lot of non-contextual speech on the part of the participant, and verification questions, which you see on the bottom, kind of inferring from the participant's behavior and then verbalizing it for them, resulted in more success. So these are some of the strategies that we think we can train people to use to not only improve satisfaction in the caregiver, but also to possibly improve the quality of life of the patient. I'm going to turn this back to Lindsey now.
Okay. All right, can you hear me okay? Okay. All right, just to recap a bit of what Kim said, we do know that partner communication training programs can be effective. We know that training communication partners to use different strategies can reduce the breakdown of communication and conversation. We also know that training communication partners to use some of these strategies can help, once communication or conversation does break down, to help the caregiver kind of repair the conversation so that the interaction can go on successfully. And as you can see from this study from 2014, it's a list of all the different caregiver strategies that were observed. And the ones in the red are very simple. It's things that we do in our everyday life, but these were the ones that were most effective in kind of repairing these communication breakdowns. It's things like providing more information, repeating what you said, rephrasing or making your speech simpler. And so these simple things are able to kind of increase the communication interaction. And as Kim said, beyond just the communication interaction, training communication partners, I think in this case by Rippich and all, nursing assistants, by giving them a training program about communication and Alzheimer's disease and giving them some strategies, they felt that they had a more positive attitude about their patients, and they also felt they had more satisfaction in these interactions. Okay. So just to wrap up, I want to talk a bit about, we've kind of talked about all these different ways that communication can be affected, and so what now? What do some of these strategies look like? We've mentioned a few brief ones. But I want to talk about a few that can be used across different stages of dementia, and then that also cover these three forms or three aspects of communication. I'm going to talk about what's called the FOCUS program, just because it's a structured program that has some evidence, but really there are a ton of resources about communication strategies, and a lot of these strategies you'll probably see in other places. So just to start out, the FOCUS program, the title is another nice acronym. And so in our case, our F of focused means face to face. And so I come from the view that we only have so many cognitive resources to process everything that is going on in our world. And so something as simple as reducing the distractions can help both you and the person you're interacting with focus their attention on the communication. And so one way to do that is to speak face to face. Not only does this focus your attention on the person and theirs on you, but it also gives the person multimodal cues, not only what you're saying, but they can also, read what your body language looks like or your expressions. We also see that oftentimes people with dementia feel more comfortable in one-on-one conversations as opposed to group. There's less to follow cognitively. A simple thing, turning down the TV, the radio, turning the tablets off. Again, this isn't realistic to do all the time in our conversations, but especially for the important things. Reduce the distractions. Often just maintaining natural eye contact. I'll say natural. It doesn't mean we have to be staring at our people, but just natural eye contact can cue the person's inner attention that you're talking to them, that you're paying attention to them. And then my audiology colleagues, I would be remiss if I didn't mention using your hearing aids. If somebody can't hear what was said, or they have to work really hard to hear what was said, it's unlikely that they'll be able to respond effectively or remember what was said. Our O stands for orientation, and so many of these strategies will be particularly helpful in the later stages of Alzheimer's disease. And sometimes just orienting the person to the interaction can be helpful and help them to participate more effectively. And so things like probably that we all do. Introduce yourself. Hi, I'm Lindsey from speech. Introduce your topic. I'm here to talk about your swallowing today. Often repeating key words. If somebody's having memory problems and as the conversation goes on, if they forget what you're talking about, repeating the key words, I'm here to talk about your swallowing function. How are you swallowing when you're eating? Some of those things can kind of cue their attention back or remind them what you're there to talk to them about. And then also, this is something that I've seen a ton of our people in the memory clinic at the VA do. Often we'll say, what do you do during the day? And I don't know how many times I've heard, well, we get up and we make coffee and then we sit at the table and look at the calendar. Often it's a paper calendar, and sometimes just having this calendar with everything on it can help the person orient to their day, what's going on, what activities they have coming up. And if they're confused during the day and they have this habit of going back to the calendar, that can be something effective as well. Next is continuity. Again, a strategy, especially later in the interaction, where perhaps the exchange of correct information isn't as useful, but instead this connection is most useful. Trying to stay on an enjoyable topic for as long as you can so this person can engage in social interaction. When you do switch topics, make sure you introduce that. Dad, I'd like to talk to you today about that doctor's appointment that's coming up. And so explicitly introducing the conversation so the person has a bit of a clue. And then at some point, some of the abstract concepts in our heads are not as preserved, and so talking about concrete things, oh, I see you got this table refurbished. It looks really nice. Things that are very abstract can sometimes be more effective in terms of having a connection. Whoops. Kim mentioned one of the most prominent signs, especially early, is word finding problems. And so helping the person to unstick or to get these words out can be really useful. And honestly, I feel like one of the best strategies I found is to just have a conversation with the person. It seems like when you're having trouble finding words, if I think I know, is it okay if I guess? Or do you prefer to just find that yourself and then trying to respect their choice? If the person is okay with you helping, sometimes asking, oh, did you mean this? And even repeating the sentence with the target word rather than just the word itself can help provide some context for that word. So for example, if a patient is, saying, did you start that thing outside, the cooking thing, rather than just saying, oh, the grill, maybe saying, yeah, I did start the grill 20 minutes ago, and providing some context. All right, again, in the later stages, where you're truly trying to get the person to interact meaningfully, providing some structure for their language can be useful. Kim mentioned providing structure in terms of yes or no questions, or giving the person one or two choices. And so rather than having to generate, what do you want to watch on TV? And they're trying to, locate those words or those ideas in their head. Sometimes if you provide one or two options, they can give you a choice. And I'm going to touch on this later, but also we talked about comprehension and understanding these complex grammatical structures, and being able to eliminate some of that can be really useful. All right. As I said before, beginning with common, enjoyable structures, even if the person is maybe not providing, again, correct information, if it's about the exchange, continuing with this word finding, commenting on something that you think that they're communicating. And then this is a really hard one, I think, is trying not to quiz and to comment and ask questions to encourage communication. I think sometimes we ask quiz questions, answers, or questions that we already kind of know the answer to see how the person's doing today. So we might say, oh, did you have breakfast this morning? When we already know that they probably have had breakfast, and we're just really trying to see how they are today, which is very much understandable. But if the person doesn't remember, it might be really frustrating to them. And so one option might be to, comment or ask a question to engage, like, oh, I saw the nurse in the hallway. She said you had eggs for breakfast. How were they? Engaging rather than quizzing. All right. And as we mentioned, even in the moderate stages, understanding complex grammatical structures, long, complex sentences can start to deteriorate. And so we can help our communication partners with dementia by using short, simple, direct sentences. I think this also is hard, maybe particularly for females, because we mark politeness. We're polite often by being indirect. We don't often say, I need a ride, give me a ride. We might say, oh, do you think maybe we could get a ride? And so, but that's a lot of language, and so we need to try our best to use direct, simple language that our partners can understand easily. Also, again, using keywords rather than pronouns. Again, if somebody is in a conversation and they're trying to remember who's he, where is there, what is it that she's talking about, and so repeating, John or the festival or whatever those key words are, again, can cue the person when they might be lost to the topic. And then I also will say, communication, we've talked a lot about language, and communication, we communicate in so many other ways than just language, and so don't be bashful to use all the ways that we communicate. We communicate with our body language, with our facial expressions, with our gestures, pictures, writing things down, and so really use all the ways to communicate that you can. Just to wrap up, what we really wanted to talk about today was that throughout the course of Alzheimer's disease, communication can be affected, and as Kim talked about, it might be even some of the very early signs of Alzheimer's disease. However, many of the aspects of communication are relatively preserved until mid to late stages of the disease, and we can build on those using communication strategies to really keep the person connected and to have meaningful interaction. We have a lot of resources on our slides if you're useful, and thank you very much for your time.